Many mycobacterial infections seen in clinical practice in the United States are caused by non-tuberculous or atypical mycobacteria. And just like in tuberculosis, the emergence of resistance during therapy is a problem, so a combination of drugs is used. Let's start this sketch with treatment for Mycobacterium avium complex, a common cause of disseminated disease in the late stages of AIDS. Mycobacterium avium complex includes both M. avium and M. intracellulaire, and that's why our recurring sketchy symbol is a bird, avium, in a cage, intracellulaire, as in inside macrophages. M. avium complex is much less susceptible to the usual antituberculosis drugs, so a combination of agents is used. An effective regimen includes a macrolide, such as azithromycin or clarithromycin, plus ethambutol. Macrolides will be represented by our recurring and ubiquitous macrolide crows. And ethambutol marks the return of Ethel, the cowgirl from our previous tuberculosis sketch. Her horse wrangling and sharpshooting days behind her, she's now the sheriff of this small town. Well, as you can see, she's a little past her prime. Her cane is our recurring symbol for immunocompromised patients. It's here because M. avium complex is a common cause of disseminated disease in AIDS patients, especially in late stages when CD4 counts are less than 50. Let's sketch in this speed limit 50 sign to represent this decreased CD4 count. We're also going to draw a macrolide crow perched on the sign. Azithromycin and clarithromycin not only treat M. avium complex, they're the prophylactic drugs of choice for preventing disseminated disease when CD4 count is less than 50. When treating M. avium complex, a third agent is sometimes recommended, especially rifabutin. Rifabutin is related to rifampin and has similar activity. Recall the rifampin rifle expert from our tuberculosis sketch. Well, rifabutin will be represented by the billboard welcoming travelers to the Arizona Buttes. Take a look under the billboard. We can see our rifampin rifle expert, as well as the cytochrome P450 carriage, to remind you that, like rifampin, rifabutin is an activator of the cytochrome P450 system. However, rifabutin is a less potent cytochrome activator. This is represented by the driver of the cytochrome carriage, as he pulls back on the reins, bringing the horse to a screeching halt, probably because of this town's strictly enforced speed limit. So, because rifabutin is a less potent activator, it's indicated in the treatment of tuberculosis in patients with HIV infection. These patients are often on antiretroviral medications that are metabolized by the cytochrome P450 system. Well, this brings us to the closing scene of our mycobacterial western. Let's go over the treatments for Mycobacterium leprae, that acid-fast bacterium that causes leprosy. Mycobacterium leprae is represented by this leaping armadillo, running away from some danger that we have yet to reveal. Recall that the armadillo is an animal reservoir of the disease in the United States. Well, like TB and M. avium complex, leprosy is often treated with a combination of drugs. The most common drug is dapsone, represented here by our dapsone deputy, in the deputy zone. Let's illustrate two side effects to keep in mind. Notice he has a sand timer next to him, as he waits for his shift to end so he can finally hit the saloon. The sand timer represents agranulocytosis, like the descending granules of sand. Also, dapsone can cause hemolytic anemia in patients with G6PD deficiency. This hemolytic anemia consists of bite cells, red blood cells that the spleen took bites out of in order to remove Heinz bodies. Take a look at the watermelon slice that our inattentive deputy is enjoying. Think of him biting out those pesky seeds like biting out hinds bodies. And notice the G6PD free sticker on our watermelon. Certified organic, of course. The deputy doesn't know it yet, but there's a villain lurking in the shadows, like a lion stalking its prey. It's a sinister Mycobacterium cowboy from the infamous lion posse. He cleans his gun as he prepares to make his attack. Well, that cloth is our symbol for clofazimine, a drug added to treat lepromatous leprosy, which presents diffusely over the skin with leonine or lion-like facies. This lion-like face can be seen on our outlaw who's taking advantage of our negligent deputy. Remember that rifampin is the R in RIPE therapy for active tuberculosis. Well, it's also effective in combination with other drugs in treating atypical mycobacterial infections, including leprosy. Hence our outlaw's rifle. Well, that's it. Let's sum up this sketch. Keep Mycobacterium avium complex in mind in patients with AIDS and CD4 count less than 50. Macrolides such as azithromycin and clarithromycin are the prophylactic drugs of choice. Treatment includes macrolides, ethambutol, and rifabutin. At our deputy zone, we cover Mycobacterium leprae, which is often treated with dapsone. But watch out for that agranulocytosis and anemia in patients with G6PD deficiency. Rifampin is also added for long-term treatment. And remember to add that clofazimine cloth for lepromatous leprosy. You know, a rifampin rifle is a tool, no better or no worse than any other tool. An axe, a shovel, or anything. A gun is as good or bad as the man using it. Remember that.